We're going to look at the Cochrane reviews associated with osteoporosis. Unfortunately, there aren't many. As you can see on the screen, we've got calcium supplementation post-menopause, vitamin D for preventing fractures in older people, and calcium and vitamin D supplement for people who take corticosteroids. Um, so, and even what you see here, I'll warn you, is going to be fairly disappointing. But it's what's known, and it's what we have the best information on. Again, Cochrane reviews tend to be the best definitive source for what we have because they review all the medicine, all of the medical surveys and clinical trials that have been done. We got into this because we were talking about sarcopenia. Sarco meaning muscle, penia meaning loss of. Loss of muscle is lethal. So then we got into reps versus intensity in terms of resistance training. And as you can see, that doesn't even come up here under the Cochrane reviews. We talked about weight vests and weight bearing there. Now, as you'll see, there's a couple of mentions of weight bearing in the Cochrane reviews here, but not really significant studies. I will cover some studies that there are studies out there about use of weight vests, and I will tell you, they're disappointing as well. But that's a conversation for a different video. We got a lot to cover on this one, so let's get cracking. Did I mention the lighting's bad? My appearance is maybe not that good. We're here at the beach house, and the sun hasn't come up yet. Janice is in the other room, so I'm trying to. I wanted to knock this content out and make it available. So that's where we are. So, calcium supplementation post-menopause. Well, actually, let's cover that in just a minute. Let's do a brief. It's worth doing their intro on this topic of osteoporosis. It describes a condition where bones become porous and fragile, so that they're more likely to break. It happens when the natural process of breakdown and formation of bone or remodeling is unbalanced, and that happens particularly with aging post-menopause. Fractures as a result of osteoporosis are a major cause of poor health, so this is a big deal, especially for women. The spine's most vulnerable. Most of these occur with fractures of the spine. Other vulnerable areas are the neck of the femur, broken hip. Quite often you hear, "I've fallen and I can't get up," that old scenario. Actually, quite often the broken hip preceded the fall and caused the fall. A lot of people don't know that. The wrist or forearm often breaks as a person puts out their hand to break a fall. Both estrogen and testosterone help, and that's obviously the English spelling of estrogen, and testosterone help maintain bone. Postmenopausal women and elderly people are more prone to osteoporosis. A petite body frame, insufficient exercise, poor diet, smoking, especially, which reduces estrogen levels, and hormone-related conditions, such as our old friend diabetes, or maybe I should say our old enemy, hypothyroidism, taking steroids, which you see with inflammatory diseases such as rheumatoid arthritis. Now, here's that mention about weight bearing. Weight bearing exercise is important for maintaining bone strength. But as I said, that's about as detailed as you get in the Cochrane analyses. We'll have to wait for other studies to get a little bit deeper into that issue. Bone mineral density is used as an indicator of osteoporosis. Now, here's a critical piece. We live in an age of technology, and most of us tend to just accept any lab or imaging result as gospel. Bone mineral densitometry, for example, does not give an accurate prediction of the likelihood of bone fracture. So a lot of the studies used bone densitometry, and we're saying, well, how does it do in terms of bone loss? You need to realize that even in and of itself is not an accurate predictor of the likelihood of bone fracture. So again, so many assumptions just don't hang totally true. The quote gold standard that we use to decide whether we're losing bone material, bone mineral, really doesn't help us in terms of predicting health outcomes. Now, a healthy diet rich in proteins, vitamins C, D, and E, and minerals, calcium, phosphorus, magnesium, and manganese, with weight-bearing exercise are important to maintain strong bones and prevent bone fractures. Well, again, that's just an obvious statement, but again, no reviewed evidence to support that. So here, below we present evidence from Cochrane's systematic reviews related to porous and fragile bones. Studies are included in these reviews if they meet the predefined Cochrane criteria. So calcium supplements for reducing bone loss in postmenopausal women. As you will see, bottom line is a little bit of help, but not a whole lot. Researchers made a thorough research of the literature, found 15 well-conducted trials, total of 1,806 postmenopausal women randomly assigned to receive 500 to 2,000 milligrams of calcium, different forms, gluconate, carbonate, citrate, with or without vitamin D, versus a non-active supplement or placebo. That provides the best evidence we have today. It was more effective than placebo in reducing rates of bone loss. So everybody would say, well, let's take it. But only by about 2%. For total bone density, lumbar spine, hip, wrist, and lower forearm. And again, 2% on a bone densitometry, which we've already mentioned, doesn't really predict falls and fractures. So is it worth it? 5 studies with 576 women measured the fractures as an outcome with treatment with calcium studies. All 5 trials investigated the influence of calcium on vertebral fractures without a clear benefit. Only 2 trials reported on non-vertebral fractures, and very few fractures occurred, making it difficult to determine any benefit taking calcium compared with placebo. Side effects, they were not reported, so it's not like there's a big issue. In fact, we'll talk about side effects a little bit later in review on this Cochrane article. Other people have vitamin D for preventing fractures in older people with osteoporosis. What is known is older people often have low vitamin D levels. Vitamin D does act on the intestine to increase absorption of calcium and reduces loss of calcium by the kidneys. Maintaining calcium levels does protect bones. Biggest source of vitamin D is usually from sunlight. There are a few dietary sources such as oily fish, but they tend to contribute relatively little. People not exposed to the sun can get a supplement. And I would say that even in people living in the sun belt, they still need a supplement, just from experience, what you see. However, how much is that supplement helping in terms of fractures and osteoporosis? Again, not a whole lot. Vitamin D is inexpensive. The analogs, calcitriol and alpha-calcidol, are more expensive, and as you'll see a little bit later, not necessarily that helpful. No evidence that derivatives of vitamin D have any advantage compared with vitamin D. For elderly people in nursing homes or residential, may suffer fewer hips and other non-vertebral fractures if they're given vitamin D with supplements, with calcium supplements. But again, very small amount. 7 trials, 10,376 participants. 8 people had fractures in the group receiving supplement for every 10 in the placebo. So a significant number if you look at that. However, the numbers are so small, you really have to question from a statistical perspective how significant that is. That was the problem with this group of studies. When you look at non-vertebral fractures, 7 trials, 10,000, again, the same pool of people, 9 compared to every 10. So again, you say, well, maybe a 10% decrease. That's not enough actual fractures to say there's a significant, at least a very significant impact here. Now, vitamin D alone showed no clear effect on hip fractures in 7 trials with 18,668 participants. Spine or vertebral fracture in 4 trials with 5,700 participants, or any new fracture in 8 trials with 19,000 participants. Vitamin D with calcium reduced hip fractures slightly. 7 trials, again at 10,307 participants. Relative risk was 0.8, as we mentioned before, and relative risk for non-vertebral was 0.9. No evidence of effect of vitamin D with calcium on vertebral fractures, and it appears to be restricted to those elderly people living in institutional care. Side effects. Now, I mentioned we would talk about side effects for a minute. I'm just going to summarize this side effects section. The bottom line was they said there used to be a lot of concern about significant problems. Vitamin D can wreck your kidneys. It can cause kidney failure. And I've actually seen, I haven't seen the patient, wasn't involved in the case, but I do know a physician who had a case among his patients. This patient started taking and continued to take 25,000 international units of vitamin D. The physician obviously did not recommend that, but that did cause kidney failure. If you look at the literature, and I have reviewed it in that area, I haven't seen kidney failure associated with vitamin D at levels less than 120. And so if you may remember, a typical poor or low level that we'll tend to see in a new patient is in the 20s, not the 120s. And the goal tends to be to get up to between 40 and 60. So again, a third to a half of the levels that start to get into the danger zone. And they make the same comment here. In the past, there have been serious concerns that vitamin D may have been associated with hypercalcemia, given in only moderate doses, which may have led to cautious use of low doses in the trials of vitamin D. So their point is, you know what, a lot of this may have happened, this poor results on the trials, because of the cautious and low doses of vitamin D. There's increasing evidence that potential toxicity has been seriously overestimated, and the doses required may also be more than previously recognized. So what you may see is an increase, and I'm sure you will. You see that as a pattern in medicine, increased use and increased doses of vitamin D. So what may happen then again is you may see a whole new crop of these types of trials with higher doses, and they may start to show more results. So calcium and vitamin D for osteoporosis in people who take corticosteroids regularly. Again, where you see that is with inflammatory diseases, inflammatory disorders like rheumatoid arthritis. What the research says appears, again, same thing. Benefit of calcium and vitamin D appears to be modest. So, without going into further detail on this, if you've made it this far, again, I appreciate your attention and interest, and we'll do some more on what studies there are out there regarding things like weight vests. Thanks.